Through the Substance Abuse Treatment Advisory Committee, the committee that I created last year, we're making available some 2,000 heroin overdose reversal kits to Kentucky hospitals with the highest rate of heroin overdose deaths. These kits contain the drug Naloxone, also known as Narcan, which immediately reverses the effects of a heroin overdose. Overdose patients will receive a kit free of charge when they leave the hospital, so they or a loved one can prevent another overdose event and possibly save a life. Attorney General Conway will detail where the kits will be provided and how this program will work. They represent an important step in this fight against heroin, but it's only a step. I join with Kentucky families, with our Attorney General, with our First Lady, with both law enforcement and health care and treatment officials around this state in urging our General Assembly to make this one of their very top priorities. We cannot delay any longer.
With about $105,000 that we had in the SATAC accounts, we are going to be purchasing over 2,000 Narcan rescue kits or Naloxone rescue kits for the University of Louisville Hospital, the University of Kentucky Hospital in Lexington, and the St. Elizabeth's Hospital System in Northern Kentucky. Now this is important because when a patient who comes into the ER walks out after a heroin overdose, if they get this kit, they're not going to be walking out with a prescription that they can't afford to fill because Medicaid doesn't cover it. They're not walking out with a piece of paper. You know, sometimes if they have a prescription, most of our pharmacies in this state don't carry Narcan. In fact, a lot of our ERs in this state don't carry Narcan. Narcan, for the most part, is not covered by insurance or Medicaid. So they will be walking out, they and their families will be walking out of our ERs in our most affected areas with a medication that could potentially save their lives. This is a pilot project, but let me say this loud and clear. The Substance Abuse Treatment Advisory Committee hopes that we can soon expand this program to 17 more Kentucky hospitals and hospital systems.